Hi everyone, I'm Christy Schnelton, and I am recording this PowerPoint presentation for my pathophysiology class at Capella University. I am simulating that I am the nurse educator for my hospital's women's health department. During orientation for new nursing staff, I am going to be refreshing everyone on the topic of endometriosis. Now, what is endometriosis? Well, endometriosis is a fairly common disease that affects premenopausal women, regardless of race and socioeconomic class. Endometriosis comes from the word endometrium, and this is the tissue that lines the inside of a woman's uterus. When a woman is not pregnant, the tissue builds up and is shed during her monthly period. Endometriosis happens when the tissue begins growing outside of the uterus where it does not belong. However, it continues functioning as though it were still lining the inside of the uterus. The growths will bleed during a woman's menstrual cycle, causing swelling and pain. Also, a cyst can form when the ovaries are involved, and this can lead to adhesions and scar tissue, causing problems with fertility. Now, where can endometriosis be found? Well, it can be found on the ovaries, the fallopian tubes, the tissue surrounding the uterus, and the outer area of the uterus. Other sites for growth can include the cervix, vagina, vulva, bladder, bowel, or rectum. Now, these benign lesions can actually spread like cancer from reproductive organs to other sites, like the liver, the arms, thighs, lungs, even the brain. Fortunately, the spread to distant sites like this is rarely seen. Most common symptoms that women report deal with pain and fertility. So it can cause several different symptoms, and they definitely vary from woman to woman. But it's important to remember that the severity of symptoms does not necessarily correlate to the severity of the disease. So the most common complaint is pain. That's painful menstrual periods, pain with urination, pelvic pain, pain during and after intercourse, pain with bowel movements. Aside from pain, women can experience heavy menstrual periods that last longer than normal, and also problems with fertility. So, how can endometriosis affect other body systems? We're going to briefly talk about each one that you see up here on the slides. So, when the endometrial tissue implants itself somewhere outside of the uterus, you need to remember that it's still functioning as though it's inside the uterus, so it's shedding and bleeding monthly. So, depending on where the tissue growth is located, will dictate what body system is affected and what symptoms a woman may experience. So, here's a brief rundown of how endometriosis can affect the reproductive system. All right, so the ovaries can have such bad scarring from endometriosis that the fallopian tubes can become blocked if the growths are on the peritoneal. And there can be even more pain with less fertility issues if the endometrial growths occur between the rectum and the vagina. So those are a couple examples of how our reproductive system can be affected by endometriosis. Now, as far as hormones and the endocrine system, research suggests that endometriosis is essentially an estrogen disorder on a cellular level. So the endometriosis implants have an abnormal amount of enzymes which basically produce estrogen independently without needing any help from the ovarian hormones. The abnormal growths also produce chemicals which are responsible for inflammation and chronic pain that women often complain about. Okay, now to the gastrointestinal system. Painful bladder syndrome and irritable bowel syndrome are specific examples that can result from endometriosis. Now, the musculoskeletal issues, women may experience joint pain or pelvic floor myalgia or myofascial pain. And then next, the respiratory system. This can be known as thoracic endometriosis. Now, this is a rare condition, but it can cause women to present with a cough and shortness of breath, and it's often the result of pelvic endometriosis that has spread. Okay, the next one, the urinary system. Only a small percentage of endometriosis patients have their urinary tract involved, and it's known as urinary tract endometriosis. So, when the tissue is found growing on the bladder, it can cause symptoms such as dysuria, burning sensation on the urethra, and frequency to use the bathroom. Now, this can lead to a woman's electrolytes being affected. The frequent urination can cause dehydration, which leads to a loss of electrolytes such as sodium and potassium. Okay, and then last but not least on this slide is the behavior and mental health. This can be affected anytime when a woman is dealing with chronic pain and possible fertility issues. So these are fertility and pain are issues that definitely accompany the disease of endometriosis. So always keep a lookout for behavior and mental health issues. Okay, here we have a concept map. This is displaying modifiable and non-modifiable risk factors for endometriosis. You'll notice a middle column with a few topics that could fall into both categories, and I'll go into a little more detail about that in just a minute. First, let's take a look at some modifiable risk factors. So all the way on the left column. Now, some studies suggest that endometriosis cannot be prevented, and other studies suggest that there are ways to reduce your chances. Okay, so a woman can potentially lower her chances if she avoids a diet lower in fat, if she avoids alcohol and caffeine. And it's said because these substances can raise estrogen levels in the body. And remember that endometriosis, it's essentially you're producing too much estrogen. So the diet can help. Also, by exercising, this can keep the amount of body fat down, which results in a lower amount of estrogen circulating in the body. Now, the last one up there on the left-hand column is shift work. So this has also been studied as a possible link to endometriosis. And research suggests that the circadian disruption could play a role as a risk factor. Something to think about if you're wanting to get out of working the night shift. Okay, let's move over to the far right-hand column, non-modifiable risk factors. A woman does not have control over genetics, the fact that she is a woman, or that she is 30 years old, or her previous health history. Okay, but some factors are listed in that middle column because they could fall into either category, and it's dependent upon a person's culture. For example, early and frequent pregnancy is supposed to decrease your chances of getting endometriosis, but this may not be the best choice for prevention. Also, some women are not able to get pregnant, so this would make it non-modifiable. Now, taking birth control pills are supposed to decrease the chances as well, but this is not an acceptable option for some cultures. Present illnesses is the third item in the both category, because depending upon the illness, depends on whether it's modifiable or not. The last note on the concept map, you'll see down below that chart, it's talking about possible ways to reduce the chances of getting endometriosis, but it just highlights that genetics is thought to play the biggest role. So for example, if your mother has endometriosis, you are 5 to 7 times more likely to get the disease. Here are some recommendations for our department's role in primary, secondary, and tertiary prevention. So for primary prevention, education is key. You'll notice new pamphlets and educational material that is available in the waiting room and available for the nurses to hand out to the patients on the topic of endometriosis and prevention. These educational materials also include ways to deal with endometriosis and reduce the symptoms that many women experience. Now, this will fall under the category of secondary prevention, where the goal is to treat the symptoms and prevent endometriosis from getting any worse. Now, if the treatments fail and a woman is experiencing chronic pain and infertility after medication and surgery, then tertiary prevention is aimed to help women with coping. We should strive to improve their quality of life as much as possible, and this may be achieved through suggesting a support group for them to join. Okay, diagnosing with technology. So we just talked about prevention methods, and it is secondary prevention that really relies on using technology to help in the diagnostic process. So healthcare providers, they can use a couple of different imaging tests. There's the ultrasound machine, which uses sound waves to produce images of the organs. And then there's the magnetic resonance imaging, known as the MRI, and this produces images by using radio waves and magnets. And many of you may know this, but the only way to know for sure if a woman has endometriosis is through laparoscopy. So this is when a surgeon uses a small viewing instrument that has a light, and they can look in at the reproductive organs, the intestines, or any other areas to see if endometriosis is present. During the procedure, they can take a small tissue sample called a biopsy, and it can be sent to the lab and viewed under the microscope to confirm the diagnosis. Lastly, if a patient needs to undergo a hysterectomy, modern technology allows surgeons to use a computer to control the surgical instruments in the operating room. This allows the surgeon to get into very tiny spaces with using steady control and precision, and this is known as a robotic-assisted laparoscopic hysterectomy. It's important to remember that the use of technology that we've discussed is incorporated into most treatment plans for endometriosis. So dealing with endometriosis and creating a treatment plan. So let's say we have a patient with endometriosis, because let's face it, many times this disease cannot be prevented due to genetic factors, and we need to create a treatment plan for them. Even though there's no cure for endometriosis, there are definitely ways to treat the pain and fertility issues that accompany the disease. The plan will obviously vary from woman to woman, as is based upon her symptoms, age, severity of the symptoms, and severity of the disease, and whether or not she wants to have children. So the goal is to treat the endometriosis and suppress the growth of the implants. The most common ways to treat it are those 4 bullet points I have up here on the slide. The first one, pretty self-explanatory, anti-inflammatory pain medication. Okay, the next one, various forms of hormonal therapy. Now, to expand on this a little, the treatment plan for a woman not trying to get pregnant will start with hormonal birth control, and there are various forms available. Now, if a woman is trying to get pregnant, her treatment plan would consist of being prescribed a hormone agonist. Okay, and then the third bullet statement, laparoscopic removal of endometriosis implants. This is another popular option for treating endometriosis. And then the final one, surgical removal of the uterus, tubes, and ovaries. This is known as a hysterectomy with bilateral salpingo-oophorectomy. Okay, so that covers dealing with endometriosis, creating a treatment plan. We've gone over the different types of diagnostic technology. We've gone over the different types of body systems that endometriosis can affect. Hopefully you have a better understanding of what it is. And if anyone has any questions or anything, I'm going to be around for a little bit after this presentation. I'll be happy to answer anything. Thank you so much for coming. So thank you guys so much for coming, and I will hang around if anyone has any questions. Thank you so much.